right, so we'll go ahead and get started. Hello and welcome, everyone. As always, thank you so much for coming to our monthly community of practice on this beautiful Friday. If you received our email reminder, you know that today we'll be talking about the value of status conferences and the importance of them. We have Mel Brothers and Jenny Kimmel here today with us to present on what status conferences are and what their processes are in Genesee County, as well as the many benefits to holding status conferences. So before we start, I believe there may be some new faces here today. I think it's really exciting when we cover topics that span across multiple disciplines and are relevant to multiple parties in this AOT process. So with that being said, I wanted to, as I did last month, give just a brief introduction of what this space is for and why we started it. The Center for Behavioral Health and Justice started these back in July of last year with the intention of holding space for professionals to collaborate, communicate, and get information, excuse me, gotta move my cat, and get information that may not be readily available to them in their normal day-to-day. So this space is usually specifically for CMH folks and CMH providers, but because of how important we know this topic is of status conferences, we wanted to kind of more broadly advertise it and have everyone who is interested be able to attend the presentation today. So if you're new here, if you've never been here, welcome. Thank you so much for coming. And yeah, let us know if you have any questions in the chat or raise your hand. So finally, before we dive into our presentation, I always want to plug those AOT Q&A sessions. I'll go ahead and drop in the chat when they are in July. But in case you're unaware, we have an AOT drop-in twice a month with our AOT expert, Dr. Scott Smith. He's made himself available on the second Monday and the third Wednesday of each month. So it's just like kind of like an office hours sort of drop-in meeting where you can come and talk with him about any AOT related questions. And this is open to everybody, including families and advocates as well. So you can always point families and family members, individuals towards that as well. So this month, or sorry, next month, it's going to be, well, I will drop those in the chat. So if you have any questions that don't get addressed today in the meeting, you can definitely attend one of those Q&A sessions and bring that to Dr. Scott Smith. So we're going to go ahead and jump into our presentation. I'm going to go ahead and introduce Mel Brothers. Mel Brothers is a paralegal with Genesee County in their Restorative Justice and Violence Reduction Strategies program, as well as their AOT programs. Although she started this position earlier this year, she brings a wealth of experience and knowledge to the position. She has an extensive background in providing consultative services for project management and as a project manager for both companies, as well as court and justice programs throughout the nation and in Canada. She has successfully been employing over a dozen projects in both county and statewide implementations. She has worked in various manager positions for several physicians' offices and is extremely, she has a bachelor's degree in criminology and criminal justice, and she has a passion for working with people that have diversion opportunities within the criminal justice system. So thank you so much for being here, Mel, as well as Jenny. I believe you're kicking it off, Jenny, for the first slide. So I'll go ahead and kick it over to you. And Devon, you can go ahead and start sharing that presentation.
All right. Hello. Can everybody hear me? Okay.
Yes.
All right. Hi, everyone. Thank you for having us here to present on status conferences. Next slide, please. Before we begin, we want to make sure that all of you are aware that recently a bill was submitted to the Senate and referred to the Senate Health Policy Committee for review. Currently, when a CMH submits a notification of noncompliance, the requested court action is either for hospitalization or modifying the current order. In this bill, one of the many changes proposed is allowing a third option for courts to convene a status conference with the supervising agency and individual to review the individual's compliance with the AOT order. Genesee County has been doing status conferences with our probate judge for about 3 years now. We started after we received a grant and created a formalized AOT program. In other states with AOT programs, these are sometimes called court check-ins. An SMI advisor defines a court check-in as an informal appearance of the AOT participant, a representative of the treatment team, and the AOT monitor before a judge or court officer scheduled during the period of an AOT order. The purpose of the check-in is to discuss the progress of the participant and the treatment team in meeting their mutual ongoing obligations. Because counsel is often not present, the court will not take legal action on the case during a check-in. And any need for such action that may become apparent during the check-in is postponed until a formal hearing can be scheduled. For us, counsel is not present during our status conferences, and if it is determined that a formal hearing with counsel present is required, then our court schedules what we call a review hearing. Our status conferences have been very successful in several ways, of which we'll talk about later. Next slide, please.
As Jenny mentioned, status conferences are an informal meeting with the probate judge, the AOT ordered individual, and CMH staff to discuss the individual's status to adhering to that AOT order. This platform provides what's called the black robe effect. And this is the idea: individuals want to please the judge, and in a manner that the judge not only wields a stick, but a carrot. Individuals don't want to report to the judge that they're not doing well, and what they're supposed to be doing is, and to have the judge, risk sending them back to the hospital. They don't want to share that their progress is bad, and they want to continue to show that they're making strides in their treatment and get praise for those efforts. The judge holds an unbiased stance to both the CMH and the individual accountable. She listens to both parties and provides direction for either the CMH or the person to do the things to assist in the adherence of their AOT order, to promote their recovery, and ultimately independence of the individual on that AOT order. Next slide, please. Not everyone on an AOT order goes to a status conference. The CMH identifies that someone's not following their AOT order, does not need hospitalization at the present moment. However, they assess based on historical information. If the noncompliance were to continue, a hospitalization would likely be in that person's future. The goal is to prevent that hospitalization and help someone get back on track with their mental health services. After the CMH identifies the need, they file a notification of noncompliance request for status conference at probate. This is an amended scale form specific for Genesee County. The court reviews the request and, upon approval, provides the date and time for the scheduled status conference. The CMH then provides the individual and interested parties, such as their guardian, a notice of status conference, and returns the form with that proof of service to the probate and AOT paralegal, or me. The AOT paralegal then adds the individual to the status conference docket, which is really just an unofficial schedule, not an actual probate court docket. Next slide, please. These are the amended scale forms that Genesee County uses for the request for status conference and the notice of status conference. And then we just use the standard proof of service forms. Next slide, please. Every person involved has a specific role in implementing the streamlined status conference process. We typically spend maybe 5 minutes or less for each person. And of course, if someone else needs more or wants more time with the judge, then the judge will allow that. We're not timing these. Each individual just is based on need and how much time that they need at that time, some more, some less. But because each person knows their role, there are things that are happening concurrently, and it's like a well-oiled machine, and the judge and the case manager can focus on the conversation with that particular recipient. Next slide, please. And with that, I'll turn it to Jenny.
Our status conferences are very similar in feeling as to mental health court, but there are some very notable differences. One difference is that there are no pre-court conferences with the court and CMH. All conversations with the judge happen at the scheduled status conference. Similarity is that all the consumers are scheduled at the same time for the status conferences, and names are called by the monitor of who is in attendance for them one by one to go up to the podium. And their assigned case manager stands up with them at the podium. The first status conference, judge usually gives them an orientation and reminds them about their AOT, what it means, and what her expectations are. Typically, the very first thing she addresses are medications, making sure that they are compliant with them, that they feel like they are working, and they're not having severe side effects. She may do things like direct the person to have a medication review and the case manager to attend it and talk to the individual about how they need to take responsibility to report issues to the prescriber and why. Once she ensures medications are managed well, sometimes over the course of several status conferences, then she will focus on other concerns. If it's not the first status conference, judge gives an overview of the last time you were here and asks the individual for an update. The case manager is always addressed after the individual speaks. In these ways, she's holding the individuals accountable, encouraging them to advocate for themselves and take responsibility for their treatment. And she's also promoting some self-determination. After the individual provides their update, she will ask the case manager if they have anything to add. And then she'll give directives, praise, or reminders of things that could happen. Some examples of what I mean when I say reminders are things like when the individual does not comply with her directives, she'll remind them that she can order them to be sent back to the hospital if they're not compliant with their mental health treatment. She'll tell them things like, I want you to leave here and go get your injection right now. And then she'll turn to the monitors and say, if they don't do it, give me the paperwork and I'll sign for the pickup order. Or because our judge has been a probate judge for a really long time, she knows many of our people and their stories. An example of reminding people of one of their stories could be, reminding somebody of time that they had to spend in jail after they were charged with a crime when they were non-compliant with their mental health treatment. And she'll remind them of their past and non-compliant with treatment. And then she gives them compassion that she doesn't want to see them go through that again. She encourages them and reminds them of what good things they have going on in their life now that their mental illness isn't interfering with it. It's extremely important to note that we do not provide any sanctions or punishments, such as sending someone to jail. This is also a notable difference between status conferences and mental health court. The only consequence that we have are giving pickup orders to go to the hospital when it's warranted. So when they first arrive, she may remind them that she can send them back to the hospital. The second they start to take steps towards recovery, she's providing praise. And what I really want to highlight is that even though the reason to start the status conference is a notification of non-compliance, it quickly transforms into a platform to gain praise from the judge when they take steps down the path to recovery. The judge assists with the motivation to keep coming back and getting praise from her for their efforts and then discussing their next steps for recovery. As Jack Welch said, giving people self-confidence is by far the most important thing that I can do as a leader, because then they will act. Getting praise from a judge helps to build their self-confidence that they can do this and recover. And having it in a group format, others get to see their peers get the praise from the judge. Witness someone who is in their same boat succeed, and that also gives them the confidence that they can do it too. Another point to mention is the HIPAA consideration. During these status conferences, it's important for the CMH not to speak on specific treatment, but rather the compliance with the order. For example, instead of saying they aren't taking their Abilify medication every day, we would say they're not 100% compliant with medications and probably at about 50% compliance. Also remember that the judge asks the individual first So they're the ones who are usually giving the details about their services and treatment to the judge. So they can talk about whatever they want about their own treatment. The judge might ask the case manager if they agree with what the individual said or not, but it is not the CMH bringing up the detailed specifics for the treatment. Another example, the judge may ask the person if they're using any substances and if they're in SUD treatment, if they're court ordered for substance abuse treatment on the order. And the individual might say, I use marijuana every day and I don't go to treatment. I don't like NA meetings. And the judge might ask the CMH, could you get them into outpatient SUD therapy? CMH would say yes. And the judge would say, okay, I want you to work on that. And when you come back, I want to hear that you went to an appointment or you at least have something scheduled. With this type of interaction, it's mostly the person providing the information. If the person does not volunteer the information and the judge didn't know to ask, then the CMH could say something at the end when she asks them, do you have anything to add by the judge? Something vague about treatment, such as, yes, I have concerns about them needing to attend their medication reviews, which then prompts judge to ask the individual questions about their attendance or lack thereof and provide direction. Lastly, it's also important to have the person sign releases of information. As a standard practice, our CMH asks everyone on an AOT or deferral to sign a release of information for the court. They can refuse to sign it, but it's our practice to always ask. Next slide, and I'll turn it over to Mel.
Thank you, Jenny. This is the format that we use for the docket and notes. We added in a couple examples, but we de-identified them, obviously. In this, you can see that they've made some significant strides towards recovery and that judge had provided some praise. In another example, the individual did not show, was overdue for medications, and the monitor submitted paperwork for requesting a pickup order. I want to also note that we keep detailed documentation within the prosecutor's electronic record as well. And it's a secure record, so it doesn't get put out on the portal or anything. And only the persons involved in the AOT program have access to those cases. Next slide, please. One more time for me, Devin. Thank you.
Right. From an experiential standpoint, we were able to come up with several benefits of having the status conferences. We saw individuals who were not wanting to do something when we talked to them about it, have a status conference with the judge, and then do the task. It seems to us that individuals are more likely to do something because they're expected to report back to the judge on whether or not they did it, and the judge is an authority figure. I cannot prove this, but our team fully believes that we have diverted hospitalizations for people. We've brought people who are not compliant with their medications to a status conference, and afterwards they started taking their medications. The individuals gain a relationship with the judge. Oftentimes, our individuals don't have many natural supports in their life, or at least positive natural supports, and the judge is a support person for them. She demonstrates that she cares about them, and they care about her too. They want to hear the positive affirmations from her, and they don't want to disappoint her. We have individuals who write her letters, are excited to come to their status conferences to tell her what they've done, and often thank her for caring. A quote that one of my case managers shared with me when they provided a notification of status conference to their individual was, he told her, can we make sure to tell the judge that I really appreciate her and that I have this AOT? Since this is a place for individuals to have a place to talk directly to the judge, they will and do. They will complain about staff, services, and barriers, and judge helps them to try to problem solve it. She encourages them to take the proper avenues for those complaints by encouraging them to talk directly to the person that they're having issues with or follow the process to make a formal complaint. Sometimes she uses the information that's brought up to note to review a guardianship file and will schedule a hearing to gain more information on a situation that is told to her during a status conference. For example, if an individual makes complaints on things that their guardian is doing and it seems worth reviewing. It's another avenue in which the judge shows that she cares about them and takes their complaints seriously. They might not always get what they're asking for, but they always have their complaints heard by her, and she provides avenues in which to investigate their complaints to see if there's something that she should or should not do. Next slide, please. Thought about drawbacks, we could really only come up with two. Since the consumers do not have to attend the status conferences, the ones that choose to not show don't get all the benefits of attending. But even if they don't attend, just knowing that their progress is being regularly reported to the judge can be enough motivation for the individual to want that good report to the judge, just not to be there themselves for it. The case manager will encourage them to attend and lets them know that the status conference will still be held without them if they do not. They let them know that if they don't go, they don't get the chance for their voice to be heard. And then the other drawback we thought of was that it takes additional time and effort for staff at our CMH, probate, and prosecutor's office, but we believe that the extra effort is worth it for the benefit of the individuals. Next slide, please. In addition to the affirmation and increased medication compliance that I talked about, we've witnessed other successes towards recovery as a result of the positive influence that Judge has on the individuals who attend the status conferences. We've watched her encourage people to decide what's next and to get doing something, which has resulted in people volunteering in the community, working out. We've had individuals come in and talk to the judge about side effects they were having from the medications that they never mentioned to the CMH staff. And, she directed the person to have an emergency med review and the case manager to attend to help facilitate that conversation with the prescriber. If they hadn't mentioned the problem to the judge, it's unknown if or when they would have told CMH staff about it, and they could have decided to stop taking the medications because of the negative side effects they were experiencing. We've watched individuals make such progress in their recovery that they've been able to move from a supervised living setting to an independent living setting. And we've also watched individuals who are hesitant to get into substance abuse treatment start attending and stop using illicit drugs. Overall, we've seen many people take positive steps down the road to recovery, and it's not cookie cutter. Since each person has their own time carved out to talk to the judge, their recovery plan is individualized. Like I said before, once medications are addressed, we are immediately talking about what's next and including the individual in that conversation. So while one person's next might be working on independent living, another person's next might be getting out of the house and creating more natural supports. Next slide, please. And I just want to note that status conferences are just one of the many tools that can be used for people on AOT orders to help prevent hospitalization, increase their compliance with their AOT order, and that subsequently can increase their insight into their mental health needs. Our judge encourages medication compliance, therapy, substance abuse treatment, community integration, and overall recovery for the person. Status conferences are not for everyone. First, they should only be requested when a person is starting to not follow their AOT order. And second, there needs to be a clinical thought process behind bringing somebody who will respond to the judge's back rub effect. So in our team meetings every Monday, we talk about consumers that may benefit from a status conference, and we might make a clinical decision that it would not be appropriate, or we might decide it would be appropriate. An example of someone who might not respond is someone with antisocial personality disorder. I'm not saying that's a clear-cut disqualifying diagnosis, but when we think about the diagnosis on a continuum, someone with moderate to severe symptoms of the disorder is not likely to respond to the judge and their authority. And so then we wouldn't ask for the status conference on somebody that was not going to respond. Next slide, please.
So we had a conversation with Judge and asked if she could give her perspective on why status conferences were important for the consumer and for the CMHs. We asked her why she does them. If it's not a statutory requirement, why spend the time to do them? And her answer was very simple. And she said, I want to get to know the participants. I want to know what makes them want to get better. We continued to talk and asked her what benefits did she see by doing status conferences. And it was simple for her again. She said that she wanted to make sure that her expectations were realistic for each of the participants. And she can only know that by doing these status conferences, making sure that the questions that she asked them are very direct and pointed for those people, making sure that the things that they're being asked to do or required to do are right for their treatment plan, and that they're not struggling. And if they are struggling, that they're getting the help that they need from their case manager and from the other resources involved in their treatment. So we asked then what would she recommend other counties do to start with conferences? And she said, make sure that you're getting all the services that they need for success and what success would mean for each of your individuals. So making sure that you understand the participants that are in your programs and that you reach out and your case managers are involved with them. To make sure that you understand that if they don't do what they're ordered to do, that there are consequences, even though they're not formal consequences. They could be ordered to go back into the hospital. They could be ordered to extend their AOT order. They could have some consequences, although not formal. And then also that you understand that it's used as a motivation to get those participants to comply with their services. So that black robe effect again. And then we asked if judge were in the position that we're in, how would you approach a judge to start setting up status conferences? And she said that she not only recommends that other courts have the same type of hearings and approach things the way she does, but just to ask in open court, just approach when the case is called and say, can we start doing status conferences? And can we just increase the number of hearings that we have for this individual, the frequency that this person is heard? I don't think they're getting the support they need. I think they need more. Can we do this for them? And to submit in writing or in open court what you need for that individual. Just advocate for them, as Jenny always says. Make sure that that person's being heard. And that's it for me.
Next slide.
Wonderful, wonderful. Thank you so much, Mel and Jenny, for presenting on status conferences. I absolutely love this presentation. I really am so interested in status conferences and how others are experiencing them in different counties, because this really feels like a great way to humanize this process. And I love the aspect of the judge and the individual starting and maintaining a relationship and a rapport. I do love that aspect of it, but it's coming in through the chat and probably in people's minds, like what is the barriers in capacity and others. So to address some of the questions in the chat, I'll go ahead and just start in the order that they were put. We had one person wondering what the numbers of those forms were that you had used for the status conferences. Is it a PCM?
It is. So I just put them in the chat also so that they'd be there, but it's GC PCM 230A and GC PCM 562A.
So the scale forms that we used were the PCM 230 and the PCM 562. And then we modified those for the GC stands for Genesee County. And so that's where we modified them from.
Well, and I'll be sure to make sure to include those in my follow-up email as well, and make sure they're added into the general folder of resources that we have for this group here. So I do believe I do believe this was already addressed, but I think that there is definitely utility in reiterating some of these things, but can the judge order them back to the hospital or to just be evaluated?
So in our county, our pre-admission screening unit is the ED at the hospital. So she can order them to just be evaluated really, but when we're talking to the individual, order you back to the hospital because that is where they are going to get that pre-admission assessment done.
And then just to reiterate, these check-ins and status conferences are optional to the individual, correct?
They are optional, but we don't present them as optional. It's just, here's the notification of status conference. The judge wants you to come. And then if they don't come, we will be like, well, she was wondering where you were at. Here's the next one. But there's no, consequences or anything like that. And then for the court order, we do ask for those court orders to also include what we decided to call specialized AOT program as part of the extra services. And that helps to identify to, probate, who are the people that are asking, that we're asking for the status conference is on. We currently are only doing the status conferences for our individuals that are in our AOT case management program because we have so many people in Genesee County that are on orders and we take those individuals that have the high case management needs. So we are taking the individuals that are most at risk. So if somebody was non-compliant with their AOT, their current case manager at a lower level of care could refer them to AOT case management. We bring them into the program and then they would qualify for the status conferences at that point. So it is kind of a slow step up and in that intensity. However, we've only done it a couple of times, but if somebody was in ACTP services, which is a higher level of care than my AOT case management, we assign an AOT monitor specifically to that case to follow that case. And the AOT monitor is the one that is showing up to court and reporting on that. We didn't want to bring, we probably have hundreds of case managers in Genesee County, and we didn't want to have hundreds of case managers showing up to these status conferences. So we kind of limited them to just our more intensive programs.
I'd like to add too, if someone doesn't show up for one or two status conferences and then they show up for another one, judge will ask them, where have you been? I've missed you. And she'll talk to them about why they haven't been attending and encourage them strongly to attend in the future. And she lets them know that the case manager still gives an update whether they show up or not.
Thank you for that. A part of the conversation or your presentation that I really liked was asking the judge, well, what can we do? What would you recommend in engaging other judges and trying to get them, the motivation or see the reason why these could be beneficial. So I really liked that part of the conversation. And I know Heather was wondering if there are barriers in terms of time and capacity when it comes to that.
So I'm just going to back up because I do see her first question too about the motivation. Judge Barkey is just amazing. She is one of the most caring judges, I'm going to say, in the nation because she is so out there. And so she started with let's do these weekly. I'm setting aside time. Let's do every Monday from 3 to 4. we can schedule as many people as we can in that time, whatever you need. And then unfortunately, our judge's health started to decline, and she had to take more time off to go, help go to appointments for her health and stuff like that. And so we have reduced them over the course of the past couple of years to once a month. And with the we could do more. She always gave that of like, if somebody needs an extra one in between that, I just bring it up to me. I'm totally willing to schedule something with you guys, but let's just have this on the calendar for once a month, because that is what my time and health can accommodate at this time. And so I think that as far as barriers regarding to time and capacity, it really, when we brought this up to judge, she was like, I'm all for it. Let's do it. If I can help these people, be compliant with their AOTs, avoid the hospitalizations, build their insights, it's going to affect my weekly docket of all the number of people who are actually on orders, because we can help motivate these people to, make strides in their recovery and get off of the orders. So, and she genuinely cares about all of our people too. So that's a huge plus. But she kind of saw it as I can spend an hour, at first it was an hour a week, and then it changed to an hour a month doing these things. And that will affect just my weekly, she calls them mentals hearings on our, weekly petitions time kind of thing. So it's multifaceted for that answer. Do you have anything to add, Mel?
Yeah, I think the first part of Heather's question was, as far as her motivation overall, and would she share as a judge to motivate other judges? I think she would. She really believes in this program, and you can tell she's extremely passionate about it. And I think the only barrier would be time. She spends so much time on all her not patients, consumers, and all of her constituents, so to speak. I mean, she is an elected official, and she does have some health concerns. They are, I'm like trying to scroll through the questions. She is not the only probate judge, but she is the AOT judge. She does have someone that covers for her when she's out, but the other probate judge does not do them on a regular. She just covers. So she is the only AOT judge.
And if she can make it to one of our status conferences, the probate court administrator is the one that sits in on those for her.
Next question is is there a regular time set aside for status conferences, or are they scheduled as needed? And it sounds like your judge was like, yes, let's have this set time weekly and just get as many as we can in that span of time. But it sounds like it could be either way, depending on the judge. Would you say that's true?
Yes, and I'd say it's both, because some come more frequent than others and some less frequent. But there is, I believe it's every 28 days that it's set, that there's, the mass docket. And then some will come, every time, some will come every other time, some, it just, the more need there is, the more she puts on.
How do these status conferences compare to 6-month reviews?
They are entirely different. A 6-month review is more official. That is formal. You have the psychiatrist or psychologist reviewing and turning in that 6-month review report. That person has the right to petition for discharge. There's counsel present. So the 6-month review is a formal process. Our status conferences are informal. There's no counsel present. There's no court action taken at those status conferences, whereas at a 6-month review, there could be.
Gotcha. And so the next question, so the status conference is not specifically identified in the AOT order.
No, it is specialized AOT program is what is in the AOT order. And then all individuals that are in our specialized AOT program are given an AOT handbook. And in that AOT handbook, it does identify to them, it outlines the entire program, the expectations, and one of those parts in that AOT handbook is stating to them that they can be asked to do a status conference with the judge.
And just so we have a frame of reference, Dr. Cummins was wondering how many people are on AOTs in Genesee County?
All right, so I don't have the number right in front of me, but I know that on average, we probably have just over 400, like 425-ish for people on AOTs and deferrals altogether. And then right around half of them are actual orders, and the other half are deferrals, I'd say. So roughly 200 people on orders.
So has or does Genesee utilize mediation prior to status conferences?
We have not. And the barrier to that right now is that mediation requires the consumer to request the service. So, and with the status conferences, the staff are the ones that are requesting the service, kind of thing. I do see it's similar to a mediation with the judge because she is unbiased. She will be just as quick to get after my case managers about things that they're not doing to support the person as she is to, get after the person for not following their AOT order. So it is kind of similar in, that unbiased stance to try to resolve an issue. But as far as those official mediation services that are available to people, typically our consumers do not want to request the service, so it's not happening.
They know it's an option though?
Yeah, we let them know it's an option.
Well, so can you talk a little bit more about the incentives that are given from the judge at the status conferences? I know you talked a lot about praise and applause, and it's a great opportunity to have it be a positive experience as well. So what other incentives are utilized?
So we talked about having little gift cards or something like that, but unfortunately we could not come up with the funds to support those like tangible incentives. So really it is, the praise, the motivation, the judge allowing their AOT order to be less and less restrictive. She's told people, if you do X, I'll tell the team that you don't have to live in that supervised living situation anymore and you can move out. So they are untangible motivations, but there are, those motivations behind it. We can, when somebody is finished with their AOT order, we kind of will give them a certificate saying, you did a great job. You don't need this AOT order anymore. You can now, voluntarily participate in services. And I think that's the only like tangible thing that we give them, but it's just a lot of motivation and praise and helping them meet goals that they want to meet.
I've seen when they come in, they'll ask her things like, well, I like to come here and talk to you, and I feel like I really get more motivation by it. And then they'll say, but it's hard for me to get here. Can I get a bus pass? And they will instantly get them a bus pass. I mean, they're they make sure they have whatever they need to be able to participate and get the support that they need. But like Jenny said, I've heard her say, well, what do you want? What will make you happy? And then let's work towards that. So she gives them a lot of encouragement and then wants their input on what will make their life the quality of life that they want.
Great. So I think it would be valuable because there's questions in the chat about how to engage judges that have limited time or motivation to participate in status conferences. And I know you did touch on this in the presentation. I think it would be a great thing to reiterate. What is some advice or some suggestions you'd have for folks here that want to engage their probate court and their prosecutor's office in starting to hold these conferences?
So I think, like Judge recommended, doing it in the open court sessions. When you're turning it, say you need to turn in a notification of noncompliance and you're asking for a hospitalization and you're testifying in front of the judge at that time, bringing it up then of like, hey, this is like the, third notification of compliance that I've turned into you. And I know that some other counties are doing this. Would this be something that we could do for this person? Maybe start it off small. I do know that Judge Barkey would be willing to talk to people, like other judges about it. So you could tell your judge, Judge Barkey does it. If, you wanted to talk to her, she'd be willing to talk to other judges. And just kind of, I would start off very small. I would start to see if maybe in my experience in talking to other judges, it seems like the ones that do mental health court are more interested. So maybe approaching the ones that do mental health court, because they're kind of already doing it just in a different way, right? They're getting to know their people, they're talking to them and stuff like that. So maybe trying those judges. And,
Great.
tell them I'm asking for an hour a month.
Maybe ask them to have a conversation with Judge Barkey.
So the next question I see here in the chat is, does this still occur for clients who are in private practices and only AOT monitored by the CMH?
Yeah. So for us, we've only done it for those that are in the AOT case management program under the CMH. It would take a lot of planning and stuff like that to extend it outside of that program. And I know that our judge wants the case managers there. She has directed, because they are the ones that know the person the best. And that would be kind of hard for, getting maybe a private practice person to show up to those status conferences. And then also for her, having the consistent case managers is helpful. And from a CMH standpoint, if we take, I have 4 case managers for AOT case management. If I take 4 case managers and send them to the status conferences for all of the people that could come, that's only 4 case managers that are out for an hour. If I open it up to everybody and the case manager for all of those cases had to come, now we're looking at, 30, 40, 50, however many case managers that are assigned to all the different cases, having to take that hour out of their day to come. So it was just kind of a logistics at the time that we started doing these for planning.
Looks like the last question in the chat is, if a person is represented by counsel and the counsel does not attend the status conferences is there a waiver in place from the represented persons council to allow the prosecutor's office to participate in the status conferences?
So council doesn't attend these. These are informal. So because there's no legal or court action that's going to take place at the hearings, council's not attending. This is just the individual and CMH and her having a conversation. If there is an action that needs to take place, it doesn't take place at the status conference, and it is scheduled for a formal like review hearing or whatever it might be. And then that's when the council is notified of that review hearing. And so that's when that would come into place.
Okay. Wonderful. There was a follow-up from Barbara saying, but a prosecutor cannot speak or with the represented.
There's not a prosecutor in it either.
I think Barbara might be referring to me being the paralegal for the prosecutor's office. So my only function in that setting is to take notes for the judge. Because there's no one from the clerk's office there. It's just GHS, the judge, and then me to take notes for the docket because I maintain the docket. Is that what you meant, Barbara?
Okay.
I think so. Yeah.
Okay, perfect.
Yeah, and so she's not speaking to the individuals. Those notes are just for us. They're not getting shared with the prosecuting attorneys and things like that.
Yeah, they're not even put in the record. They go nowhere except to the judge and GHS. And then in order for me to schedule the next status conference, because I maintain the docket for her, that's it.
Okay, so those are all the questions that were in the chat. Does anybody have any final questions or even just thoughts, sentiments that they wanted to share before we close out here?
I came from Wayne County. I just want people to be mindful that, and Jenny, you can comment on this. I'm not sure how much of this court time, because it is an expensive process. Civil commitments are not free. You know, the member has to pay for the attorney. If they can't afford to pay for the attorney, there's a waiver for all of that. And so, you know, the cost that's involved, I know you all had a SAMHSA grant, and I'm not sure, or maybe you can speak on that, what was covered from the probate side from your SAMHSA grant, if at all. And then the other part is the status conferences do not preclude or exclude the CMH, Chris, from doing their clinically obligated responsibility. And I'm sure your judge talk about that in the status conference. You still have to do your due diligence to service the member so that they can adhere to the order.
Yes, it does not preclude any of our other responsibilities. This is just an addition thing that we're doing that we are, and really, like, my staff do have to attend. The consumer doesn't have to attend, but my staff do. And it's just to try to help these individuals. And it was a way to kind of formalize using that black robe effect. You know, as we know, a lot of people waive actually attending their AOT hearing. And so they're not getting that time right in front of the judge. And so this is another avenue in which to get that time in front of the judge. And then as far as the grant, probate did not want any money from us for that grant. So this is entirely funded through probate, through their own funds. For the grant has paid for my staff time that has been unbillable, and these status conferences are unbillable time for the case managers. And then it also has supported Mel's role as the AOT paralegal at the prosecutor's office to help kind of streamline that process. And for ongoing, we did have Genesee County did pass a millage, and so that will continue for not for the case managers. Case managers are kind of just going into the regular CMH case management roles where they're funded through billing, and any other thing is just funded through GHS's budget. And we are using the millage for the monitor positions and to continue the AOT, supporting the AOT paralegal position at the prosecutor's office. But as far I was gonna say, but as far as status conferences, that's 1 hour a month that the millage is paying for of her time.
Great. Thank you so much, Jenny. And thank you so much, Mel, for attending today. Before we sign off, I just wanted to remind everybody that in my follow-up email, I'll always include specific forms, the PowerPoint, as well as other things that are mentioned here. So I will be including that in the follow-up email. And also in that follow-up email, I have a link to a shared folder where pretty much that's where we're storing everything, every relevant doc and tool that we are going over in these meetings. So just be on the lookout for that. Anybody can access that shared folder, that shared AOT community of practice folder with just the link. So if that is something you wanted to share out to someone else who might be who might benefit from that, you're more than welcome to do that as well. And that's where the recordings are of these meetings as well, that you are more than welcome to review. So again, thank you so much. Yes, I will see everybody Friday, July 26th at 11 a.m., where we will be discussing a lot of these legislative changes that are coming down the pipeline. So again, thank you so much. If you have any residual questions or thoughts, you can go ahead and email me. And yeah, everybody have a great weekend.